Okay, hello everyone, and welcome. We're really excited to have this chat today. Myself, Dr. Natalie Scheeler, and Dr. Mark Davis here from Foundational Medicine are joined by Kyla Fuller to talk all about helminths and helminthic therapy. And Kyla has a really interesting perspective because she herself uses helminths to help manage her IBD and has been so successful. Now she helps others to do the same. And so our goal today, talk a little bit about what helminths are, how they're used, why they're used, and then also the other side, the perspective and experience of using helminths from Kyla. So I will turn over the mic to you guys. If you want to introduce yourselves, tell us a little bit about yourself and how you found helminths. Kyla, if you want to start.
Yeah, sure. First of all, thanks so much for having me. I'm really excited to be here. So yeah, my name is Kyla. I'm a Canadian who lives in Australia. I've been using helminths now. Actually, today's my 2-year anniversary of starting the therapy. So I started July 22nd, 2023. And yeah, obviously I've had a lot of success using it, and I'm just so excited to create content and spread awareness about this really amazing therapy.
Awesome. Awesome. Mark.
Awesome. Yeah, so I'm Mark Davis. I'm a naturopathic doctor, and I'm a fellow of the American Board of Naturopathic Gastroenterology. And I have been using helminths therapeutically with patients for about 12 years. And I've tried several kinds out myself, which I'm happy to talk about today as well. And I work at Foundational Medicine with Dr. Scheeler, working mostly with patients with inflammatory bowel disease, but patients with other indications too, and sometimes advising people on helminths for non-IBD indications as well.
Awesome. Yeah, I think it's cool. We all have firsthand experience of using helmets as part of the talk,
Mhm.
which is helpful because it is a little bit more niche and kind of a little bit out there.
Yes.
Um, Before we dive too far in, we do want to make a disclaimer that this is not medical advice. This is educational only, and so always talk to your provider before making any changes to your healthcare. Um, but diving in. Mark, do you want to start us off about 101? What are helmets?
Okay, yeah. So helminths are tiny little worm-like organisms, usually microscopic, that live in the guts of every kind of vertebrate on the planet. So anything with a spine. Every kind of bird has some kind of helminth that has evolved to live inside it. And every kind of fish and every kind of mammal, including primates, including us humans. There are helminths, tiny little worm-like organisms, whose only ecosystem they can live in is the human gut. They're so matched to us over hundreds of thousands of years of evolution. So that's what a helminth is. And they're in the class that most people lump into parasites. So when people talk about parasites, they're usually really talking about protozoans, which are single-celled microorganisms, or helminths, which are these tiny microscopic worm-like organisms. And really, it's not accurate to call them all parasites because the definition of a parasite is something that lives in or on a human or in or on some kind of host and gets its food or other benefits from living there and causes some kind of harm. And we have a different word, which is commensals, for microorganisms that live in a host and don't cause harm or don't help either. And then we have this other word, which is mutualists, for microorganisms that live in a host and cause benefit. And some microorganisms cause so much benefit that the host organism could not live without them. Like termites don't actually digest wood. It's little microorganisms that live in termites that digest wood. And humans couldn't live in a healthy way if we had sterile guts. We need our microorganisms to drive health in so many different ways. And so there are harmful and neutral and helpful viruses and fungi and protozoans, even, and bacteria, and definitely helminths. And out of the hundreds of thousands of species of helminths, there's a few that we have figured out can be safe and effective to help humans. And we're going to talk, I'm sure, a lot about how they help humans. And so our relationship with helminths has been pretty consistent for at least tens of thousands of years, maybe hundreds of thousands of years. And what has changed in the past 50, 100, 150 years is humans' relationship to their environment in general. So over the past 100 years or so, as we have started using plumbing for our poop and eating foods with pesticides on them and wearing shoes and refrigerating our food and doing all these things, which are actually all of them are great in a lot of ways, but they keep us from our microbiological environment in all these ways that maybe we all think here is a huge driver for all of this autoimmune and allergic and hyperinflammatory conditions that happen. So some people call hyperinflammatory disease Helminths deficiency. And I think there's some validity to that. So that's kind of the overview. Does that sound good? Any
That
other
was really
things?
well said.
Oh, thank
That
you.
was
Thank
really
you.
well said. Super well
Oh, great.
explained.
Great. I've
Yeah.
given that explanation many times.
Yeah, and I think another helpful thing I find like help ground the idea of using helminths is thinking about it in the same way we're used to thinking about our gut bacteria as kind of quote unquote good and quote unquote bad, that there's certain bacteria that is very helpful for us, and then there is certain strains of bacteria that is pathogenic. And similar with the helminths, that there are helminths that can be supportive and positive, and then there are definitely pathogenic quote unquote strains as well.
When we think
Um,
about probiotics, sorry to interrupt, Kyla.
Yeah.
Think about probiotics, sometimes we talk about our healthy, happy gut bacteria as our gut flora. And flora is just Latin for plants. And so sometimes I talk about helminths as the gut fauna. They're the multicellular, like animal-like things like running around in the forest of your gut bacteria and adding to the benefit of the ecosystem and the diversity there.
Yeah, absolutely. And even diving in a little bit more about the history, do you want to talk a little bit about the hygiene hypothesis specifically?
Okay, yeah. So as so you know, 200-300 years ago, allergies, for example, like weren't really a thing. That's a relatively new phenomenon. Lots of types of pathology have existed with humans forever. Cancer has been around for a long, long time. Lots of heart disease has been around for a long, long time. But some of this hyperinflammatory stuff, like allergies, is relatively new. And so as these conditions related to hyperinflammation came around, some people developed what's called the hygiene hypothesis. And they said, oh, we're too clean. Our world is too clean. And all of these bacteria that we're scrubbing away and killing off with antibiotics and keeping our kids from and keeping ourselves from, all of these things we're scrubbing away are actually valuable. And exposure to all of these things actually helps to train our immune system. Our immune system matured alongside all these microorganisms for like all of human history. And so like taking away these old friends, as some of them call it, there's a version of the hygiene hypothesis called the old friends hypothesis. It says really some of these microorganisms are friends that have been with us for generations and do the valuable work of like training our immune system in to know what is friend and what is foe. And so that's kind of those two hypotheses, the hygiene hypothesis and the old friends hypothesis. And it's really interesting because in the 1920s, 30s, 40s, we started to notice things like, oh, if we get rid of a lot of parasites and commensals and mutualists, get rid of all these helminths through anti-helminthic campaigns, well, people start to get some more signs and symptoms of allergies and stuff like that. And then in the 70s, the first report I know of is in the 70s, this allergist was like, well, maybe this whole hygiene hypothesis thing is real. And he gave himself Necator americanus, my personal favorite helminth, and was like, oh my God, the hay fever I've had every summer for my whole life disappeared that summer and then was gone the next summer too. And it had been 2 summers in when he wrote this paper about it. So that was in the 1970s, and that was kind of the launching off point of us understanding how to use helminths therapeutically.
Yeah, and you said this, but I also want to just highlight that All of these things, the hygiene practices, the introduction of anti-helminthic drugs are all on a public health lens and an individual health lens, very good things. They've prevented a
Hmm.
lot of disease, but we started to notice that there could be also some of these unintended consequences and starting to think about, okay, what are those consequences?
Mm.
Okay. Switching gears a little bit to the experience of someone with IBD using helminths. Kyla, can you tell us a little bit about kind of the story of your diagnosis, kind of treatment history, pre-helminths, where you were?
Yeah, sure. So I started suffering from IBD symptoms in 2010. Like many people with IBD, I was kind of dismissed at the beginning. And it did take a little bit of time to get a proper diagnosis, but I did receive a diagnosis of Crohn's disease in 2016. After my symptoms just progressively got worse and worse. It was actually I had a very inflamed ankles. Actually, my ankles became so swollen that I had kind of lost the ability to walk, and I went to the hospital and was told that I had broke both my ankles unknowingly. Anyways, eventually they determined that I had basically one of the side effects, sorry, symptoms of Crohn's disease is that you can get very inflamed joints, and that was just basically what led to my diagnosis. Um, and from 2016 to 2023, I guess, my Crohn's just progressively got worse. What at the beginning was like just an inconvenient stomach ache and occasional swollen ankles, definitely turned into something that controlled every aspect of my life. Like many people with inflammatory bowel disease, I suffered a lot,
Hmm.
especially from 2018 to 2023, the 5 years before I started using helminths. I was pretty much in an ongoing flare. I had 6 surgeries in 3 years, related to having a complex fistula. Um, so yeah, I've just had a really rough go, and I developed total food intolerance for over a year. I was getting most of my calories from meal replacement shakes because I couldn't digest enough food. I've been on TPN, like intervene nutrition, which was really horrible, and just severely malnourished for years, and suffered all the consequences of that pretty much, including being severely underweight. Um, I'm officially now the weight that I was before I got really sick in 2018, which is like a huge health goal. So feels like a pretty big deal to me,
That's
actually.
amazing. Yeah.
Yeah, yeah. So yeah, I would say that the symptoms I experienced before I got well would just be like most people with Crohn's, like severe abdominal pain, bloody stools. I also had a lot of nausea from my Crohn's. I would vomit 2 or 3 times a week, which isn't a typical symptom for many people with Crohn's. Um, yeah, I had, like I said, severe food intolerances where pretty much all foods that I ate caused a negative reaction in my body, which also caused a lot of mental health issues as well, because you start to have a lot of food fear, and it's almost like a type of like eating disorder that you have to be able to eat, but you're so scared of doing it, and so you, like, I would avoid eating because it just was such a horrible experience. So develop all these, yeah, like traumas from these experiences, especially hospitalizations and drastic upheavals of my life where I had to stop working. And so yeah, that that compared to where I am now is just such a change, like such a, like, literally my life took like a U-turn 2 years ago
Yeah.
to this day.
Yeah. And before we started recording, we were talking about you
Hmm.
told us that you've been living on a boat for 6 years, you said? I
Hmm. Eight
imagine
years, yeah.
8 years. I imagine
Hmm.
managing those symptoms on a boat added an extra level of difficulty.
Yeah, yes, it does. I mean, living on the boat can be more affordable, so that does obviously make it easier if I'm not able to work full time,
Hmm.
which has been really helpful to my health. But I will say that living on the boat, having kind of like the alternative lifestyle, is probably part of what made me more open to helminths and other alternative
Hmm.
therapies that I trialed, because I guess I'm really willing to try something a little bit different, and that's
Hmm.
definitely what I would say helminths are.
Yeah, yeah. And when you were first diagnosed, did you know that you were interested in alternative therapies, or were you kind of going through conventional route, or tell us a little bit about that?
Well, like, I guess maybe this also has to do with my boat. When I was first diagnosed, my partner and I were in the process of buying our boat, and we had this big dream of sailing from Europe to Australia. And I told my doctor that, given that I had just been diagnosed with Crohn's, and he was like, "No way, you cannot do that. You need constant medical care. You cannot just sail away and not have a doctor looking after you." And I was very determined that I was going to heal myself on my own using all the healthy diets and good mindset and as yoga and walking outdoors and all the good practices that you should do to look after yourself. And I mean, at the beginning, I was fairly successful at managing my disease. I wasn't too sick at the beginning, but over time, I did progressively get worse and worse. And then those things that were helping me at the beginning basically didn't really help me anymore, and nothing kept me in remission. Even really strict diets, even completely devoting my whole lifestyle to keeping my body well, it wasn't enough. And yeah, I just got sicker and sicker.
And then helminths, how did you stumble upon them?
Sure. So one in 2022, I went to I traveled to India to have surgery for a complex fistula that I had. And after the surgery, I was in remission for a couple of months for the first time in like 3 years. And I felt pretty good. Not like I feel now, but pretty good, I wasn't pooping blood anymore, and I was vomiting less, and I just was feeling better, and it was really like uplifting, and then it just all of a sudden changed, and I was just completely sick again. And that really messed with my mental health. Just that brief moment of feeling better and realizing like, whoa, I feel sick a lot of the time.
Yeah.
And then have it all crashing down and happen again. It like almost broke me. Anyways, I posted on a Facebook group just saying like, I am so desperate. I don't know what to do. I'm doing all the things and getting nowhere. Please, someone give me some advice, And I kind of made a commitment to myself that I was like, I'm going to look into everything that everyone comments. So I got like 5 or 6 comments, some advice, and I looked into some of the stuff, and like a lot of it was like some stuff I'd already tried, like obviously lots of dietary things, following Joe Dispenza's work, if you know who that is. He's like a mindset guy. And then things like following medical mediums advice, drinking a lot of celery juice, just that kind of advice. And then someone commented on there saying, Helminthic therapy changed my life. And I was like, I Googled it and I was like, no, ew, no way. That's way too weird. And I just like immediately moved on to the next thing. But when I read through the list, I was like, well, nothing really seemed that good. And I kind of came back to the worm thing, and I looked a little bit more into it, and I was like, hey, this actually kind of makes sense a little bit. And I started to hear about the hygiene hypothesis and read some of the clinical studies done into helminths and IBD. And although they are usually with small groups and some of them haven't been successful, there is definitely some really convincing evidence out there. And yeah, I just started reading the personal stories, joining the Facebook group, and I was just totally convinced. Like I was convinced almost immediately once I started reading into it. I just thought, this is what I've been looking for. This is why we have IBD.
Yeah, absolutely. And I feel that's a very common reaction. I think I was introduced to Helminth via Dr. Mark. I did my second year of residency under him, and I was shadowing with him, and he was talking to it about patients, and my reaction was like, also ew. As is honestly most patients, that if we bring it up to patients, I feel like that is mostly the reaction we get. So oftentimes two patients will come looking for support to us because they know that we have backgrounds with using them. But if we're the ones introducing it, I feel like I very commonly get that ooh reaction. I don't know if that's your experience.
Oh yeah. In fact, I've had it so much that if somebody hasn't heard of them, or they're not coming to us for helminths, I try to mention it at the end of the first visit, because I say, look, this is a weird thing. I'm going to send you some things to read if you're interested. I'm going to plant the seed. There are a lot of other things to talk about. Diet and herbs and drugs and probiotics and a million things. But this is really helpful for some people, but it takes some thinking about. And so I'm just going to mention it now, and maybe we'll bring it up again in 6 months or something, and maybe we won't need to, but and then it does often take people a while of thinking about other things and trying other things before that's the therapy they want to jump to.
Yeah, absolutely. And I think too, as we talked about earlier, there's that kind of stigma of the quote unquote parasite. And two, if you look at some comments on social media or things like that, where if they are talking about it, which is also very minimal, and we'll talk about that with you, Kyla. But people will talk about like blood-sucking leeches and compare it to just kind of things that aren't the same.
Therapy, I guess.
Yeah, yeah. Yeah. And so you've mentioned it, but now since after using helminths, you seem to be in a great place compared to at least where you were. Do you want to talk about that a little bit?
Yeah, sure. So now 2 years into the therapy, I would say that I classify myself as feeling great most days, like obviously everyone has their ups and downs. And but I would say in general, I've been in clinical remission since July 2024. So for 1 full year, I've been in clinical remission now, the longest I've been in clinical remission my whole adult life. And I would say that I probably have, from where I was 3 years ago, a 90% reduction in overall symptoms, which is like amazing. I still have two lingering symptoms, I would say, but of the I had like 40 or 50 symptoms before. So this is an excellent, I feel very happy with the progress that I've made during the therapy. And yeah, I guess now I'm at the point in the therapy where they say that you're probably at the mark where they say if you will have known by now whether or not you've failed or been successful with the therapy. And I can definitely say that I've been successful. So I'm definitely can confidently say that this is the best thing I've ever done for my health. Definitely.
That's awesome. That's awesome. And two, I kind of touched on or hinted at when you were looking at this process, you did have the Facebook group, which for listeners who don't know what we're talking about, there is a robust online Facebook group with a lot of self-treaters who share their experience and collect research and put it all in one place. That can be very, very valuable if you're interested in helminths at all. We definitely recommend that group. That's actually how we found each other. I think Kyla messaged me or from some post or whatnot, but via that group. So that's a resource. But when you were kind of looking for more information, very limited as far as other social media outlets, is that right?
Yeah, for sure. So being a millennial, the first thing that I did when I first heard about Helminthic therapy via a Facebook comment, I immediately went to Instagram and just searched for helminths, and there was like less than 100 uses of the hashtag.
Wow.
This was back 2 years ago. Yeah, but I was shocked. And to me, that was kind of like almost a red flag because I'm like, hey, if this works so well, like, why is no one talking about it? Why is there not people like shouting it off the rooftops, But I know now people in general, I think one of two things happens. They're either maybe embarrassed or like don't know how to speak about it publicly because they're afraid of how people are going to judge them. Or the second option, which is they just get better and move on with their life, which is definitely ultimate health goals. Like that's the reason, that's what we're all hoping for, So totally fair enough. But I think that that's part of the reason why it's so taboo, and it does really work for some people that, yeah, you just don't see that much posted about it. But so yeah, that's basically one of the reasons why what motivated me to create Let's Heal IBD, my account that I run about raising awareness about helminths, specifically for the use of inflammatory bowel disease. That yeah, I just wanted there to be information out there. So someone hears that from this YouTube or from a podcast or from a friend, that you can look and see all these videos that I've created on how to do it, what it is, how it works. And yeah, just literally it seemed I wanted to make it more accessible for the average person, basically.
Yeah,
Thank
that's
you.
awesome. Yeah, that's super helpful. And I do want to dive more into more specifics about your experience, but taking a step back so that everybody watching is on the same page, just want to talk a little bit more about specifics about helminths. Mark, do you mind walking us through kind of types of helminths? There's four that we mainly use or use for therapeutic benefit. You walk through this for us.
Yeah. So if you go to that Facebook page or the Helminthic Therapy Wiki, which is also very robust, you'll hear people talking about 4 species. There are other kinds that can provide help, but they're either super hard to get or maybe they have some side effects or other things. So there's 4 that are commonly used. And 2 are native to humans and 2 are native to non-human animals. The non-human ones, the first one is HDC. That's Hymenolepis diminuta cysticercoids. And that one goes back and forth between rats and beetles. That's its native life cycle. So that one you have to take every couple of weeks usually, because rats and beetles don't have robust immune systems like humans. So basically our immune system kills them off after a couple of weeks. And so, but they really do help some people. And for IBD patients, in my experience, they can take the edge off. I've taken those ones just to find out what it was like to take HDC.
Yeah.
Um, and
Real quick on that one.
yeah,
Oh, sorry. I was
go
gonna
ahead.
say the other thing I think is fun about that one, or you mentioned before that you can consider it the quote unquote gateway helminth. Um,
Mm-hmm.
and since it only lasts 2 weeks because it doesn't colonize in humans, and so if you are unsure about taking helminths, it can be a great one to start with because it passes through relatively quickly. I just think that's a fun
Yeah,
gateway.
that is fun. It's like kind of affordable comparatively, and yeah, if you don't like it, you just stop taking it, and that's it. It's gone. Um, the other non-human one is the pig whipworm, Trichuris suis, and this is really interesting because we've got a bunch of studies on this one because for a while there was this German company called Ovamed that thought we can commercialize it, and they were running some clinical trials even in the U.S. And it's this company in Thailand that raises these germ-free pigs that just the only microorganism in their gut is Trichuris suis. And those ones are, of course, just native to pigs, and you can take those as well. That's the second type. That one is probably the one I've used the least with patients, and I've never taken it myself. And there's some really cool anecdotes of that one for use in populations of autistic kids. So that's the place where it pops into my mind, is in that population. There was even a blog called Autism TSO. TSO stands for Trichuris suis ova, TSO. That was really interesting, documenting one family's journey with an autistic kid and TSO. So those are the 2 non-human ones, HDC and TSO. TSO is Trichuris suis ova, and then there's Trichuris trichiura. That is the human whipworm. And they're called whipworms because if you look at them under a microscope, they've got these long tails that look kind of like a whip. And that one is only in humans. That it's evolved exquisitely to live in us. And so they live for they say 3 to 5 years. And in my experience in people with Crohn's in particular, it's more like 2 or 1. Sometimes it depends on how severe the inflammation is. But that's one. And that one lives in the large intestine. And it eats our mucus, and it technically is a blood-sucking parasite. It does latch on and consume little bits of our blood too. That's Trichuris suis. I'm sorry, Trichuris trichiura. And the last one that's in humans is my favorite, Necator americanus. It's the New World human hookworm. And that's the only one that's given dermally. The other 3 are taken orally. And that one, it's when you get it, and I've given that one to myself twice, given it to friends, family members. I gave it to a colleague on stage at a big conference once. That was fun. And many patients, of course. So it arrives, you get a little vial. They're invisible, and you just pipette it onto a bandage, basically, put it on your skin, and then it has this complex life cycle where it moves through your skin and into your blood, and it ends up in the small intestine, where it also does. It latches on and sucks your blood. And the cool thing is, as your blood is entering it, all of your inflammatory messaging molecules also enter into it. And it can sense how inflamed you are and release over 1,000 different proteins. We're just starting to understand all these different anti-inflammatory proteins it releases. And it releases different ones based on how inflamed you are and what kind of inflammation you have. So it's there are groups working, pharmaceutical companies working to turn some of these proteins into IBD drugs. I wish them well. I hope they work really well. But it's kind of like you've got a mini doctor inside your gut understanding your inflammatory levels and producing medicines based on that. It's amazing to me.
Wow, I didn't know that about NA, that they were able to secrete different chemicals or different levels of chemicals based on your inflammatory levels. That's
All of them,
incredible.
all four of them do that.
Wow.
Yeah.
Wow. I did not know that. That's so interesting.
Yeah.
Mhm.
Yeah, and I'm curious. So I guess both of you can answer this question as far as because both of you counsel patients or folks who are interested in doing this. What you think about, especially with an IBD lens, of kind of what you think of first, or what your experience working with people or yourself has been with the different helminths.
Do you counsel people on different helminths, Kyle?
Me specifically, I just counsel people on Helminthic therapy in general. So my
Great,
goal
great.
is just to provide education to people who want to learn about the therapy, and then they themselves can decide whether or not it's for them, essentially. I'm just there to guide them to the right resources. I also have a very clearly laid out how-to guide that I created. And yeah, I just provide information to people about the therapy in general. But I can say from my own experience and from what I have read on the wiki and through the Facebook group, that NA is very good for Crohn's disease, and that TSO can be beneficial for both NA, or for both Crohn's disease and ulcerative colitis.
TSO and TTO? Is
Yes,
that
yeah,
your? Yeah, yeah.
yeah, and TTO, yeah.
Yeah, great.
Is that your preference, Mark, or
Okay, so like I said, HDC is kind of my gateway, so people are a little nervous. I do think it is the mildest action of all the four of them. Um, but has the fewest side effects, it's the most affordable, and I have seen it kind of take the edge off of IBD symptoms sometimes. So I've never seen it put somebody in a clinical remission, I don't think. Um, and then TSO, I would say I really haven't used that for IBD, so I don't have a experience there. TTO, the Trichuris, trichiura, ova, um, and NA, I've used both of those a fair amount for IBD, and I feel a lot of love for them in my heart. I spent about a year growing out Necator americanus in my lab and getting to know them and see them under the microscope and pipetting them up and giving them to patients and other people. And I really feel like they're my little buddies. So, I, yeah, I mean, Necator americanus does live in the small bowel. So I think of it a little more for Crohn's, which can also cause hyperinflammation in the small bowel. But I've also seen it be very helpful for people with ulcerative colitis. And TTO lives in the colon and is attracted to areas where there's more inflammation, where there's more mucus, which is one of the things it eats. And so I think about that more if there's colonic disease, be that ulcerative colitis or Crohn's colitis. So colonic disease makes me think of TTO. Crohn's ileitis makes me think more of NA. And I'll use the two together sometimes. I find that to be really valuable, and I've thrown HDC on top of one or both of those two. So I do like mixing and matching them.
awesome, awesome. And then Kyla, as far as your experience, are you comfortable sharing what you've used personally?
Yeah, sure. So when I first heard about Hellman's, I actually didn't really I didn't necessarily read the wiki as clearly as I should have. So I just decided I was going to try HTC, and I got, I think, 2 doses from the supplier. And then unfortunately, the supplier shut down, and I no longer had access to it here in Australia because currently there is not access to HTC here. So I decided to change Hellman's, and I started with NA because, mainly to be honest, because it's pretty affordable, and I was worried about committing a lot financially to the therapy that I wasn't like 100% sure was going to work for me, keeping in mind that I've tried like a million things before this. So I'm used to failing a lot of therapies. So yeah, I started with NA, and I used only NA for the first 5 months of my experience with Hellman's. And then basically I freaked out. I was so scared about failing the therapy. I was so scared that I wasn't going to get better because at that point I hadn't really noticed any improvements. So, which is normal for lots of people who do Hellman's. And I think that's something that we should talk about at some point, is the timeline for Hellman's. But yeah, like at month 5, I wasn't really feeling better. So I decided to add TSO. And basically by week 26, I did start to have some improvements to my food intolerances first, actually. I started to be able to tolerate some foods. I was having some meals that had less pain, which for me was a huge, huge deal because obviously you have to eat to survive. So those are the 3 species that I have tried, and I currently use NA and TSO.
Gotcha. Yeah, I think that's an important part about the timeline too, because if somebody's coming in with an active IBD flare, I'm not thinking helminths as far as getting them out of it. Mark, do you want to touch on that a little bit as far as timeline or Kyla either?
Yeah, same. I'll just throw out that I'm always kind of breaking my IBD patients into different groups based on where their inflammation is and how severe it is. And, and I'm always thinking, what am I going to do in the short term, in the medium term, and in the long term? And helminths is one of my most powerful therapies for long term. But, I tell people it's probably going to be 6 months minimum before you start to see benefit. I have seen it faster. I love it. I love it when it's faster. And I've seen it be slower. I have a patient, usually I'm doing multiple things with patients, short, medium, and long term, all at the same time. But I had a patient who we just brought on TTO, the Trichuris trichiura ova, and nothing else, nothing else. And no benefit after 6 months. He wasn't a regular patient, didn't see him that much, didn't start anything else. And he came back after a year and he was like, this has changed my life. And this is the only thing I can imagine that did it. It followed the pattern I kind of expect for helminths. I agreed with him that it was helminths. And it didn't really start to benefit him until 12 months. So, if somebody is severely active, 99% of the time, I'm not giving them helminths. I am working with maybe prednisone or Qingdai if they have ulcerative colitis, one of my favorite herbs, or other meds and herbs and diets. Certain diets can really make a difference quickly. So there's a lot to do. But I do tell people who are thinking about helminths, settle in and get ready to just wait for them to mature and grow up until they can understand you and start to affect you. How about you, Kyla?
Yeah.
Yeah, sure. So I think that's really great what you say to people, that you have to expect to wait at least 6 months. And that's what I try and actually portray on my page. So like I mentioned, from my personal experience, I didn't notice any benefits at all till week 26. Then I saw my food intolerances start to improve. It wasn't actually until around month 8 that I really saw my Crohn's disease symptoms improve, when I started like vomiting less. I stopped having blood in my stools. But then the changes happened pretty quickly, because by month 11, I was in clinical remission, and basically have not had that many symptoms since then. I'm not sure if we're going to touch on this later, but I do also want to say I did have some pretty big setbacks during my first year on worms. And I do really try and portray this on my page, because like Mark said, it's not a quick fix. And I was super sick when I started helminths. So during the first year, I was hospitalized for 6 days. In I think month 9 of my experience with helminths. So after I'd already started to get better with my Crohn's disease, I was hospitalized because I had severe abdominal pain. I have never been hospitalized for pain before. Okay, this was like nothing I'd experienced before, and I was told I had micro perforations in my bowel and an inflammatory stricture, and I was pretty devastated, because obviously not only did I have to take antibiotics, which are probably going to kill my worm colony, but I also was just thinking, why is this happening to me? I was like starting to get a little bit better, like really felt like I was on the upward trend, and then suddenly I have this setback. But I did notice a couple of key differences, mainly that while I was hospitalized, I didn't feel as sick as I had in the past. Like I was still able to eat the gross hospital food. I was out walking every day, and my bounce back, like I recovered. And in the past, like this would just be another downward spiral for me that I would maybe not fully recover from, but I fully recovered from this. And my recovery was fairly quick, actually. Within like 2 weeks, the pain had completely disappeared. And yeah, I just kind of moved on with my life. And I don't think that that would have happened if I hadn't have had the helminths and continued the helminth exposure as well, because I have noticed, and I did actually want to say this because this did happen to me recently. I do notice that if I have eaten something that harms my colony, like coconut is a big one for me, or if I don't take my worms on time, I notice that my symptoms start to uptick a little bit. I actually had 4 days 2 weeks ago that I was pooping blood for the first time since April 2024. This is like the first time I really had any sort of serious Crohn's disease and side symptoms, and I was like devastated. I was sobbing in the morning before going to work, and it was just like bringing back all this mental trauma for me and all these bad experiences I've had, and I'm just so scared that I'm going to get sick again, you know. But I do think that I harmed my colony by eating the coconut, and then I also made some poor dietary choices after that, eating a lot of like low quality cheese, which I know still affects me if I eat a lot of it. So yeah, but now I feel completely fine. I'm haven't had any blood since then. I didn't have any pain or nausea, and I just recovered. Like the bounce back when you have helminths on your side is huge, because I feel like with Crohn's, there is no bounce back. You know, you slowly get worse and worse and worse. So that's massive in my opinion.
Yeah. Yeah, and I appreciate you sharing that and showing us some of the not, I guess, like social media friendly of, oh, this is amazing, this is the best thing I've ever done, and all that kind of stuff. Because it is helpful to hear. And oftentimes too, I mean, we, Dr. Mark and I use helminths in our practice, but it's often not the only thing keeping people in remission. It sometimes can be, and for certain people, that is all they need. But certainly not the case for everyone. And not everybody has this kind of picture perfect case. If they have IBD or if they don't have IBD, there's mixed experiences. So it's helpful to hear that from somebody who's using the platform.
Yeah, for sure. That's really my goal, is to share like my honest experience with helminths. I actually created a blog before I created my Instagram page, and on the blog, I was just not necessarily sharing information about helminths. I was just sharing information about anything that I was trying for my IBD. And then when I found helminths, I really like hyper focused on that because it worked. But I do also want to just comment on what you just said, that I do want to say that helminths isn't necessarily the only thing I'm using to manage my Crohn's. I eat a anti-inflammatory diet. I am very strict with what I eat. I don't eat ultra processed foods. I do know that that makes a huge difference, because when I stray from that diet, I do start to have an uptick in my symptoms. So I am definitely using my diet as part of what's helping to manage my disease. And I also eat a lot, 3 different probiotic foods every single day, most of which I make myself. So I know I'm getting good quality probiotic foods daily, which is huge for Crohn's because there's a huge element of the microbiome in the disease.
Absolutely. Yeah. Great. And I want to make sure, I want to ask more specific questions about your experience, but to make sure that we cover everything as far as the kind of quote unquote knowledge side of things. Dr. Mark, can you just talk about, outside of IBD, other conditions that we would think about using helminths for, people using helminths for?
Yeah, okay, I'll throw out a few of my favorites. And the first one I've got to throw out is celiac, because generally everybody in the conventional world and in the integrative and functional and naturopathic world are just like, well, if you have celiac, you have to avoid gluten for the rest of your life, and that's all we've got. And there have been 3 interesting trials looking at giving Necator americanus to people with celiac and seeing how they respond. And there have been different responses in the different trials. The last trial was kind of confusing. But what I will say is there is evidence from those trials that some people with celiac looks like they can take Necator americanus and then tolerate gluten consumption without any symptoms, without experiencing, digestive discomfort or bone thinning or all these other symptoms of celiac, without having their inflammatory markers go up, and without, in some cases, having any changes in their tissues that are characteristic of celiac. So I have had the opportunity to give helminths to a few people with celiac, and track them for a period of time. And it's interesting because every single one of them told me that they benefited in terms of their overall inflammatory picture. But all of them except one said, I'm still never going to eat gluten again. This is not my ally. This is one thing that I use to manage my hyper-inflammatory nature. But then the one guy who actually there was a newspaper article about that featured him and me talking about helminths in Portland. He was like, if I could have sandwiches and beer again, I will do anything. So we did like the trials and micro reintroduced gluten for him and slowly rose it up. And I haven't been in touch with him for over a year, but I followed him for over a decade. And he had celiac and this inflammatory spine condition called ankylosing spondylitis that left him in bed with back pain, unable to work as a carpenter for like a week, a few times a year. It was pretty bad. And gluten would exacerbate that. And now he has not had a single flare of ankylosing spondylitis in a decade. Grows them out and readministers them to himself. He's developed a cool dosing strategy over the past decade and eats sandwiches and beer when he feels like it. So that's a really cool story with celiac and ankylosing spondylitis. Ankylosing spondylitis is another one, even without celiac, that I've given it to people and seen amazing responses. I've got to throw out food intolerances that aren't IBD related. I've seen some great responses. And then there's a whole category of neurodegenerative conditions. The one that has the most support in the literature that I'm so fascinated by is multiple sclerosis. So MS is this hyperinflammatory condition. And I tell this whole story where in Argentina, around the turn of the century to the year 2000, Argentina went through this big economic collapse. They've kind of been in it ever since. But it was the Argentine Great Depression. And things were so bad that government infrastructures weren't being kept up. And there was sewage water getting into the drinking water on a regular basis. So there was this neurologist in Argentina, Dr. Correal, who knew this information about helminths and inflammation. And his patients, some of them were accidentally getting helminths. And he said to them, we could get rid of these. They're so easy to get rid of. We could get rid of them. But if you want to keep them, they might help you. So he monitored the patients who got helminths and kept them versus those who got rid of them or who never got them in the first place. And he looked at dozens of patients in the two groups combined over, I think it was 8 years, long, maybe 5 years, something like that. Big period of time. I think it was 5 years. And during that 5 years, there was a clear difference. Those who had helminths at the end were about 3 points lower on this 10-point scale called the EDSS, the Extended Disability Status Scale. And that's the difference between walking and not walking, or not walking and completely bedbound, or bedbound and dead. 3 points is a big difference on a 10-point scale that goes from 0 is you're fine, 10 is end of life. So that was amazing. And there have been several clinical trials since then using different helminths for MS that have had some signals for benefit, but not the huge, robust benefit that he saw. And I'll tell you my own little pet theory, which is that those people in Argentina were getting helminths through sewage water. So they were accidentally getting fecal transplant and helminths at the same time. So if I had a budget for it, that's the clinical trial that I want to do for MS, is fecal transplant and helminths at the same time for MS. So I don't want to take up all our time. There are all kinds of other things in the literature, some interesting signals. Since Necator americanus' life cycle takes it through the lungs, they've tested it on people with asthma to see, does it aggravate them? Doesn't. Totally fine for people with asthma to do Necator americanus. And there hasn't been that much of a signal for benefit in the literature. But if you go to the Helminth wiki, there's all sorts of anecdotes of people reversing allergies and asthma and stuff like that. So that's not in the literature, but there's all kinds of anecdotes. And I wonder what is going on with these people that isn't happening in the clinical trials.
Yeah, absolutely. I think too, like the umbrella of hyperinflammatory is something that you think about. Okay, could helminths be potentially helpful in general? And then also really quickly, another understandably common concern for patients is safety. And what are the safety considerations when using these? Either of you want to kind of talk about your thoughts there?
This was actually one of the questions that I got asked from my or my Instagram followers. I asked my followers yesterday just to ask any questions or topics that they'd like covered during our discussion. And someone asked, do you have any concerns about safety in regards to helminths? And I would like to hear Dr. Mark's opinion, but what I usually say to people is that most negative reactions to helminths happen when people take too many of them or redose too quickly. And most side effects from helminths can be avoided by starting with a low dose and gradually increasing the dose as your body becomes used to the exposure to helminths. And that's what I have read on the wiki is the safest way to do it. And that's what's happened in my experience as well. And I'd like to hear what Dr. Mark has to say about that.
So there are some commonly known side effects, like with Necator, the only dermal one. There's an itch. We've all experienced that itch. It lasts about a day. It's not the worst. And then people talk a lot about the worm flu. Now we've all gotten the worm flu. I bet. I would love to hear your experience, Kyla. And so that's like abdominal pain, nausea, sometimes vomiting that can last for hours or days or weeks in some cases, and it can be mild or moderate or severe depending on how many you've taken and what sort of immune system you have and all sorts of other things. So so those are the common known side effects. And I will say that every therapy, every medicine, herb, diet, drug, helminths, anything in the world, you never know how an individual will react. So it's possible that like any condition you have could be made worse by helminths, which is true of like every drug and every herb out there too. But actually last year there was a case report published in the literature of somebody with Crohn's who did helminths, did not reach clinical remission, went on biologics, was better for a while, got sick again. The helminths were still there, I think 5 years after they had initially inoculated, which is pretty long for helminths. That's kind of towards the end of their lifespan. And they eradicated them with, I think, mebendazole. And then the person went into clinical remission. So that's a complicated story. And the authors of the trial were conventional medicine doctors, and they attributed getting rid of the helminths to reaching clinical remission. And that may have been true for that person. Like, you really can never tell. And that's why, we have these disclaimers, talk to your healthcare provider, but like, we really mean it. It's good to have somebody on your side who can help you work through what is going on for you as an individual. So, I guess that's the most, that's most of what I have to say about side effects. There's this list of, I think, a dozen things, 12 or 14 things that are the characteristics of a helminth that mean you could use it for helminthic therapy. And one is can't reproduce inside your body. Another is can't leave the gut. Like some harmful parasitic helminths can leave the gut and go to your liver or your muscle tissue or your brain or other places. Can't do that if we want to use it therapeutically. Can't use that kind of species. So there are a lot of things that are side effects or effects, things that can happen with helminths in general that do not happen with helminthic therapy. Any other side effects that you're thinking of, Dr. Natalie?
Yeah, I just think about, I agree with everything you both said. The other thing I think about with the IBD lens that we consider is if the patient does have Crohn's disease and have intestinal strictures, there is, when you inoculate with helminths, a bump in inflammation, which is supposed to happen. That's part of the mechanism of action. And if the strictures are severe enough, that could lead to a occlusion, and that would be a medical emergency. And so that's something to think about, especially on the kind of whether to do it or not, depending on the severity of the stricture. And then if you are doing it, making sure going low and slow. One of the tools that we have is if somebody does have side effects or negative effects, too much of a worm flu, the inflammation bump is too much, we can use prednisone to help calm things down. And so that's a tool that we can use in that case. So that's one thing I think about side effects. On the safety thing that I think I get commonly asked or commonly brought up from either the person using helmets or the person's loved ones, is whether you can transfer it to a loved one or somebody close to you, a not loved one or whoever nearby. And that is no, you can't. It would be very hard to do so. It requires if you were to um, have bowel movements on the ground or not using a flush toilet, and that the stool goes to the soil and it's a certain temperature for a certain period of time, and then another person were to walk over those, then that could potentially spread it, but it's very unlikely. So the largely no to that answer. And then whether helminths can grow in the gut or overgrow in the gut. And you mentioned this, Mark, but just to reiterate it, that these helminths cannot replicate in the gut. So if you were to inoculate with 5 NA, you would have 5 or less moving forward. You will never have 6, 7 unless you were to re-inoculate again. Those are the big ones I think about or commonly get asked.
Yeah, sure. I actually wanted,
Yeah.
sorry, just to add something, just my experience with Dr. Mark mentioned worm flu, and I've also heard other people's experience with IBD when they first start helminths. Just to be completely open and honest, I actually was on prednisone when I started helminthic therapy. So that probably reduced any sort of side effects that I may have had from the therapy. But at the beginning, basically, I was so sick. I had constant diarrhea and abdominal pain. And during the first exposure to helminths, I didn't notice any side effects at all. That's probably because I had such bad abdominal discomfort anyways. But I think that's actually not that uncommon for people with inflammatory bowel diseases, because you're already experiencing all these worm flu-like symptoms. You're not necessarily going to notice if you inoculate with a small number of helminths. Also saying that, my mom has big on helminthic therapy at my encouragement. She's a perfectly well woman, but I just think it's also could be beneficial for, I've read some literature that says it could be beneficial for reducing the likelihood of neurodegeneration as people age, including Alzheimer's, and also some links to even reducing the risk of heart disease, which is super interesting. But anyways, I just fully believe that all healthy humans should have helminth exposure. So anyway, she got on board, but she also didn't notice any side effects at all when she started the therapy. She began with 5, I believe. And I actually started my first dose with 8, which was not necessarily recommended, but that's a bit of a long story.
The highest dose I've ever given someone is 50 at a time.
Yeah,
I would
wow.
never do that again. Her worm flu was debilitating, and I've written prescriptions for little prednisone tapers lots of times. Most people don't even fill them. They get the worm flu and they're like, "Oh, that's not that bad," or they don't notice it that much. But I have had some people fill them, and she was definitely one person who filled that prednisone, and it made her worm flu go away right away. She felt amazing.
Yeah, perfect.
What were you going to say, Dr. Nat?
I was just gonna say I had a similar experience. I think I did 30 for my first NA, and I had a debilitating worm flu for like 8 weeks, abdominal pain, severe. But I wouldn't have dosed with 30 again. I just was actually that was my second dosing. I did 5 for the first, didn't notice anything, and I was like, okay, just curious, let me experiment. Being generally well, and I learned very quickly. Yeah. Okay, and then the other quick thing that I do want to comment on is that if a question we get is, what if you change your mind and you do one that does colonize the gut or stays for a longer period of time? What can we do in that situation?
So that's easy. I mean, albendazole and mebendazole are drugs that kill them completely and effectively. And of all the people I've used helminths with, I think I've only ever worked with 2 who have said, yeah, I want to get rid of them. Like everybody else, even if they're not benefiting, and definitely I've given helminths to people who don't seem to benefit from them. They're like, nah, I think they're just a good part of my ecosystem. I'll keep them around. Maybe they won't re-inoculate to keep their population going for life, but they don't want to get rid of them either. So yeah, albendazole and mebendazole are very safe. They are used for babies to get rid of pinworm. They're used around the world. Can there be abdominal discomfort or other things? Sure. But the way it works, it affects helminth metabolism through mechanisms that human metabolism doesn't have very much of at all. So it's a super safe drug for humans to take.
Awesome. Awesome. And then Kyla, I have a few more questions for you as we wrap up. But you mentioned that your mom is now on the Helminth train, but what was your family and your friends' perspective, your partner's perspective when you first started doing these?
That's a good question. Basically, I have two sets of people. The people who knew me before I got well and saw how sick I was, and then now they see how I am now, they are so excited for me. Like everyone's reaction is so positive. And it's actually a little bit surprising how many people I've met who go, oh, I want to try this for I have a friend who's got Graves' disease. She wants to do it. I've got another friend who has diverticulitis. And she also wants to try it, and she wants to give it to her mom who has IBS symptoms. And I just feel like a lot of people almost feel like excited and inspired by my story that, hey, this can really help a lot of people. The other group of people who have only known me since I've been well, I don't think that I first of all don't think that they really realize how much it's helped me, obviously. But I think that usually they kind of brush it off, just like my doctors have kind of, in that, yeah, okay, you're the crazy worm lady or whatever, but I haven't really had too many negative reactions. I've had no one be like totally grossed out or anything like that. Basically, a lot of people know Crohn's disease sucks. And if you found a way to manage it, like, keep doing that,
Yeah.
because it's not that easy to find something that really works long term, like a lot of people's experience with helminths are essentially.
Yeah. And you mentioned your doctors are so they're indifferent, or kind of what was the conversations that you had with them?
So my gastroenterologist, when I mentioned to him about it, I'd already started helminths. I saw him about 2 months into my helminths journey. I did tell him because I wanted him to monitor my disease and just make sure that nothing happened that made me worse, obviously. He actually was familiar with helminths, which is actually kind of uncommon for a lot of doctors. And he actually had been a part of a clinical trial for helminths in celiac disease here in Australia. So he wasn't negative about therapy at first, but when I had an appointment with him 3 months later, he did say to me that I was wasting my time. And also he did say to me that the results of his clinical trial were inconclusive because their clinical trial was only 6 weeks long. And we've already discussed, like, helminths haven't even settled in by then, So it's not a realistic timeline. Sorry. And so, yeah, when I didn't have any benefit by 3 months, he's saying to me, you're wasting your time. You need to be taking steps towards going on a biologic. I was receiving a lot of pressure about that, which I was very uncomfortable with. And yeah, then I didn't see him for a couple of months. And both him and my GP at some points in the last year have just basically said, okay, great. They're just very uninterested and almost kind of seem like they don't believe me, like they just think that there's fluctuations in the disease and I'm just currently having a period of remission, which I guess could be true, but I've never felt this well in my adult life since I got sick in 2010. I've never felt this good, especially for this long, like where I have no pain, no nausea, no blood, nothing.
Yeah, that's incredible. Okay. And then my final question for you, as far as your experience with helminths, is there anything you wish you knew before you started?
Definitely the timeline. I mean, I think that everyone who reads the information on the wiki or joins the Facebook group, you're told like helminths can take 2 years to show full and consistent benefits. That's like the golden standard, But like I'm sure most people, I was convinced it was going to help me sooner than that, Like, and I really wish that I had understood that, yeah, I probably wasn't going to get better straight away. And just about the timeline mostly, that it does take a long time. And if I am not better by 3 months, that doesn't mean that I've failed the therapy, and that it's super important to keep going, because it would have been such a shame if I'd stopped when I didn't see remission within 6 months, or when I was hospitalized at 9 months for 6 days, or when I just felt like I really wasn't getting better and my mental health was a real mess because I was so scared about failing the therapy. I just wish that I had known, I guess, the importance of just keeping going. And yeah, Also, one thing completely separate from this, when I first began the therapy, I actually inoculated the NA incorrectly, which is why I did eventually start with a dose of 9 or 8, which I do share the full story in my blog. But basically, that's one of the reasons I created Let's Heal IBD, because I don't want people to make the same mistakes that I made. I just basically wasn't sent all of the correct information by the supplier. You're supposed to be sent like a video on how to do it. I was never sent that for the first 3 times I got my worms. So yeah, anyways, just through an error, I wish that I get at the beginning, I wish I knew how to correctly do the therapy, for mainly because then I wouldn't have done it incorrectly, but it just would have made the whole transition of starting Helminths easier if I had seen someone else do it, seen lots of like, I guess social media posts, really, because that's how most people get their information nowadays, really. Just seeing more content about it, because it would have made me feel more comfortable and confident about starting the therapy, essentially.
Yeah, awesome. I know, Mark, you had a lot of contacts before you used them yourself and using them for different reasons. Is there anything that you wish you knew or surprising things you learned from using them?
I mean, just the more that I've worked with them, the more I just think they're a part of being alive. And like Kyla said, on some level, probably everybody, or most people, it'd be good to be exposed to them. And the first few times I did them for myself, I did them just because there is that ick factor. And I wanted to tell my patients, I'm with you. Like, I don't think it's icky. I'm going to do it on myself. And I'm not even trying to reverse Crohn's or ulcerative colitis or whatever. But I actually discovered, so I did 23andMe and found out I have something called ApoE4 homozygous, which is this genetic thing, which means that I have probably like over a 50% chance, 60% chance of getting Alzheimer's when I'm 65 or older. And this group did this super cool study among this group of hunter-gatherers in Bolivia called the Chimane, where they looked at if they have helminths or not, because about 40% of them have helminths at any given point in time, and if they were ApoE4 like me or not. And if they didn't have helminths, their risk of getting dementia, Alzheimer's dementia, after they turned 65 was the same. It was like 60% after they turned 65. Huge, just like in the United States and the rest of the Western world. But if they had helminths on board, if they had helminths in their gut and they had ApoE4, their chance of getting Alzheimer's dementia was lower than the regular population. And so, sometimes I think maybe I'm meant to have these guys on board even more than most people, and it wasn't just for the ick factor. Like, that's the reason what's motivating me to bring on helminths and have them in my ecosystem like forever.
Yeah,
Great.
it's amazing. Awesome. I knew from the first time Kyle and I had a conversation that if you put three of us in a room, we could probably go for hours and hours talking about this, but I want to be respectful of everybody's schedule. Anything either of you want to share or make sure that we mention before we wrap up?
No, I guess one thing that I always like to share at the end whenever I do any sort of interview like this is just to tell people how they can find more information, because that's what I felt like I was really missing when I was learning about helminths. So mainly just want to talk and mention the Helminthic Therapy Wiki is the golden standard for information on people who want to learn about how to self-treat with helminths. We mentioned the Helminthic Therapy Facebook support group. And then also I'll mention my page, Let's Heal IBD, where I aim to spread awareness about this little known therapy, specifically for people with IBD, and I share my real life experiences with the therapy.
Awesome. And we'll put your info also in the summary. So if you missed that, it'll be written out. You can find that. And then to plug Dr. Mark and myself, we are at Foundational Medicine. We do have an Instagram, not as robust as Kyla's, but it is there at Foundational Medicine. And we'll put our info in the summary as well. But thank you so much for joining us, Kyla. This was a really great conversation. So fun. Appreciate it.
Yeah, so fun. It was really great.
So
Thanks
fun.
so much for having me. I had a really good time and I was looking forward to this all morning. So thanks so much.
Yay!
And I can't wait to see the final product and share it with my page
Same.
as well. Yeah, thank you.
Awesome. And I want to throw out too, real quick, that if you're a medical provider, that Eric Yarnell's book, A Natural Approach to Gastroenterology, is great, and I use it all the time. And the third edition's coming out soon, and I was honored and privileged to be able to write the chapter on Helminthic therapy for that. So
Wow.
I think it'll be a good chapter and hopefully a good resource for people to use.
Amazing.
Yeah.
Awesome.
Yeah, great. Thank you.
Thanks, everybody.
Great.
Bye. Thanks.
Bye.